So I'm happy to present to you a brief overview of WHO's work on global health ethics. Here's a brief outline. So what is the background to our work? I will present some key guidance documents on ethics, some training resources and capacity building activities, current initiatives, and then finally some global partnerships and collaborations. First of all, what are the areas of work and the methods of work of our Health Ethics and Governance Unit in Geneva? So we cover a quite vast area of bioethics topics, ranging from research ethics to clinical ethics to public health ethics and also governance. As a WHO technical unit, we are mostly developing international standards, normative and policy guidance in the area of ethics, but we're also, in a second step, then converting these standards into training tools and are also undertaking capacity strengthening. We're advising technical units of WHO. We have been working with most of our technical departments, actually. We are housing the WHO Ethics Review Committee for research proposals sponsored by the organization, and we have a lot of partnerships with the different agencies. Why is WHO even interested in global health ethics? So ethics, I would argue, is actually at the center of WHO's core mission, and actually articulating ethical and evidence-based policy options is one of WHO's 6 core functions. Ethics is an enabler for achieving all the global goods that WHO tries to achieve, and it is also an essential part of the global program of work, GPW 13, where it says WHO must ensure that policymakers and implementers keep ethics at the heart of their decision-making. And there's a particular importance given to the ethical issues in new and emerging scientific disciplines and universal health coverage. As you see here, WHO's guidance will be informed by developments at the frontier of new scientific disciplines such as genomics, epigenetics, gene editing, artificial intelligence, and big data. Just a word on the internal function that we have. So we are the secretariat of the WHO Research Ethics Review Committee, which has an important function in terms of risk mitigation, protecting human subjects, but also to build confidence during emergencies, where often this committee receives a lot of requests. It normally meets every month, a 27-member committee, and at the moment we're undergoing an external evaluation. Our unit has been in existence for about 20 years, and here's just a snapshot on some of the areas and documents we have been working on. So a big focus has been infectious disease outbreaks, pandemic preparedness and response, HIV/AIDS, organ and tissue transplantation and trade, research, tuberculosis, vector-borne diseases, public health surveillance. I won't go through everything. And of course, COVID-19, we were extremely busy with producing guidance on things like rationing, mandatory vaccination, healthcare workers' obligations, and so forth. And just recently, we have published a document on Mpox. I will not go through all the COVID documents, but just to say this was a very stressful time for us, and we produced many different guidance notes and briefs on research, but also on pandemic response. But luckily, this period is now over. In terms of training resources and capacity building, it's of course important for us that we don't just produce documents for the shelf, but we're also producing training materials such as training manuals or courses, but also online trainings. And we're also going into countries where we are doing many workshops, about maybe 10 per year, which is organized or co-organized by our unit, mostly in LMICs. And in the next part, I will tell you a bit our ongoing projects. So one big piece of work has concerned human genome editing, where the Director General of WHO launched an expert advisory committee in 2018. And this committee worked for about 3 years and then came out with different publications, one position paper, recommendations, and also a framework for governance. Another big focus, and I talked about the importance of new technologies in the global program of work of WHO, is on AI and big data. And there we started working in this area in 2017, established a WHO expert group on ethics and governance of AI in health in 2019, and had a number of meetings. And finally, in 2021, the WHO guidance document was published. And also coming with this was a WHO training course, which has been extremely successful with many participants from many countries. And by the way, you don't have to write all this down. If you're interested, I will certainly share these slides with the organizers. And this course is for free. So if you like to take it, you will get a WHO certificate at the end. And just quite recently, a few months ago, this was probably our best-selling publication so far. This was a document on the ethics and governance of ChatGPT and other large language models in health, which has had sort of a record download for us in ethics, and also a lot of interest from journalists and countries, so that nowadays I actually don't get to do much else than AI at the moment. But we do have other ongoing projects, of course. One is a WHO tool to benchmark research ethics oversight in countries. So essentially indicators for the good functioning of research ethics review committees that has been taken up quite well in many countries. And many of our workshops nowadays are actually implementing this tool in many of our member states. We also, very importantly, coming out of the pandemic, established an expert group on infodemic management and social listening and the ethics aspects of this. We have all heard from and suffered from the big fake news, epidemic, this infodemic that came with COVID-19. And WHO has established a infodemiology unit, which has approached us to come out with WHO ethics guidance that we're at the moment finalizing. And actually, in 1 hour from now, we will be presenting to this global bioethics meeting the final draft of this publication for a final round of feedback. Also, just this morning, I presented to this World Congress our work on developing WHO guidance on clinical ethics. We just established a working group a few months ago and hope to develop this WHO guidance document, which will be very important by 2025. We are not doing all this in isolation, but we have a number of global partnerships and collaborations. One is the Global Summit of National Ethics Committees, which meets every 2 years, and our unit is the Secretariat. We just had a meeting in San Marino in April of this year with over 80 committees in attendance. And this is really a forum for all the national ethics committees to agree on some of the very tricky issues, and especially also to exchange views and learn from each other's work. The next meeting will probably be in Bangladesh in 2026. We're working a lot with a global network of WHO collaborating centers for bioethics, which I'm managing. And you see here, we have currently 13 institutions that meet every year last in Utrecht in April this year, and they are supporting us in all of these activities, a very important network for us. Also at the UN level, there's an UN Interagency Committee on Bioethics that is chaired by UNESCO. This is when all the ethics unit of the UN organizations meet regularly, at least once a year, usually at UNESCO or one of the partner institutions, to discuss joint initiatives, for example, in the area of AI, which is becoming very important for many UN organizations. And with that, I thank you very much for your attention.